Now let's dive deep into this big LGBTQ story for today. I'm Jeff Oliverio, and let's queer up health. 7 of the top 10 states with the highest STIs are in the South. Guess which one isn't? A new report from Invigor Medical, based on CDC data, is sounding the alarm, and it's hitting the South the hardest. According to their latest study, 7 of the 10 states with the highest rates of sexually transmitted infections, or STIs, are in the Southern U.S. The report looked at the 4 most commonly tracked infections: Chlamydia, Gonorrhea, Syphilis, and HIV, and how they've changed over the past decade. In 2013, the U.S. reported 1.8 million cases. By 2023, that number jumped to 2.5 million. Chlamydia led the chart with more than 1.6 million cases last year alone. But it's not all bad news, the study says. Quote, "While syphilis infections remain at record highs, reported cases of chlamydia, gonorrhea, and HIV have declined from their peak levels in previous years, signaling a promising shift in the trajectory of the nation's STD burden," end quote. Still, disparities remain stark, especially in the South. States like Louisiana, Mississippi, Alabama, North Carolina, South Carolina, and Arkansas are all in the top 10 for STI rates. According to the study, these states tend to face persistent challenges in STD prevention, including gaps in healthcare access, limited sexual education, and structural barriers to screening and treatment. Notably, Florida, a southern state, does not appear in the top 10 for highest STI rates. Outside the South, New York and South Dakota also report unusually high numbers. In South Dakota, this is linked to concentrated outbreaks in Native American communities, where systematic health inequities and limited services worsen the burden. In New York, high urban density and strong case tracking mean more reported infections, especially among gay and bisexual men and trans folks, who remain disproportionately impacted. On the flip side, New England reports the lowest STI rates in the country. Vermont, New Hampshire, and Maine sit at the bottom of the list. Invigor Medical writes, quote, "New England states tend to be older and less ethnically diverse, both of which are associated with lower STD risk. Higher incomes and lower uninsured rates also make it easier to access testing and treatment," end quote. The data also shows that Black Americans experience STI rates over 7 times higher than white Americans, and young women, especially under 25, are at the highest risk, largely due to elevated chlamydia rates. As we head deeper into summer, a season known for fun, sun, and hookups, health experts are urging folks, especially in high-risk areas, to get tested, stay informed, and use prevention tools like condoms and PrEP.